Hello and welcome to Restore Your Everyday. My name is Cosi Belloso, physical therapist amputee specialist. And this month we've been diving into everything about wound care and skin care management after limb loss. So I had the chance to sit down and have a chat with my friend and very respected colleague, Dr. Heather Flexer. Heather is a wound care specialist with years of experience, and she is a wealth of knowledge. So I think you're going to pick up a couple of pearls here and there listening to this next interview. Hi, my name is Cosi Belloso, physical therapist amputee specialist, and I am your host for Restore Your Everyday, the place where you can come and find answers about what it means to lead your new chapter in life as an amputee, and more importantly, overcoming everyday obstacles. So this month we're going to be discussing wound management and skincare and how it relates to your life as an amputee. And to help us out, I have my friend and colleague, Heather Flexer. Heather is a licensed physical therapist and certified wound specialist at Better Wellness PT, and she is based out of New York.
Yep, upstate New York.
So guys, as you can see, I am not in my normal studio, the Restore Your Everyday studio. I'm actually at the Wyndham Clearwater Hotel here in Clearwater, Florida. So I'm guessing that you're kind of liking this weather a little bit better.
Yeah, I can move.
Excellent. So Heather, tell us a little bit about yourself. How long have you been a physical therapist?
I've been a physical therapist for 18 years. About 15 of those have been specialized in wound care.
So what qualifies you as a wound care specialist?
Well, I took a board certification, which that helps, but lots of years of practice, a love for helping wounds, and that just really got my passion started and have just continued to keep growing and learning and teaching others. So
excellent. Now, a lot of people don't understand that physical therapists are involved in wound care. How does that differentiate, for example, from a nurse who practices wound care?
I think a lot of times it is always thought of still as nursing, but physical therapists get training in the integumentary system. It's a good portion of the curriculum. It's something we see all the time. And physical therapists are able to do debridement, and they are able to do modalities which can really help a wound heal. So if you have a wound, it's really great to find a physical therapist because they're going to give you a little bit of a different perspective on how to help that wound heal. So you're going to be working with a team of people, but a physical therapist can be a great addition to that team.
And what locations and settings do you find yourself practicing wound care?
It's anywhere a wound is, so that's everywhere, right? It's acute, it's long-term care you're going to see a lot of, but then also outpatient too. So it's really can be everywhere. My personal practice is education and consulting, so I do a lot of stuff online, so telehealth as well.
Okay. Now, approximately 90% of amputations are a result of circulation being compromised, and this is usually due to diabetes or peripheral vascular disease. Can you tell us a little bit about how that process works?
So diabetes is going to affect your entire system, and it really affects the circulatory system by making those vessels harder and more calcified. So you're either not getting good blood flow because the vessels are more constricted and more narrow, or you're getting backflow and more venous stuff where the fluid's just not coming up. So it's really like a huge combination. Never mind now your sensation can be compromised as well, so you're not realizing that you're having pressure, friction, and shear and getting those kind of issues. So really diabetes just affects kind of everything.
Okay. Now, once a person has had amputation, what are factors to consider after their surgery during the healing process?
Well, you gotta follow doctor's orders. You gotta really pay attention to that incision line, making sure that it's clean, and watch for signs and symptoms of infection, any extra swelling, drainage, pain. All of that's really going to affect if you're healing, but you have got to get moving. You really cannot baby it. You've got to get early mobility. It's going to help you be able to get into a prosthetic, to be able to get the life that you're looking for. You've really got to listen to all your healthcare providers they are doing the best that they can to help you have a better outcome.
Now, obviously, one of the biggest issues after surgery and after amputation is the amount of swelling or the amount of edema present in the residual limb. And immediately after post-op, that is definitely one of the biggest factors that we have to start treating and addressing, not only to get the swelling out, but also to improve the pain level. So one of the ways that we do that is by using compression techniques, either with an ACE wrap or a shrinker that is ordered by the surgeon. Okay, so once the person has had the amputation, I always tell people the disease process is still present in the body. The diabetes is still there, the high blood pressure, the peripheral vascular disease. What is it that the person now has to take into consideration for their sound leg?
Well, like she said, the diabetes, the issues did not go away. It's in that other leg. You have got to be really paying attention to the integrity of the skin. You need to be doing the foot checks. If you can't visualize it yourself, you need to have somebody else help you. This needs to become a daily practice. If you're having issues like friction and shearing, getting good products on there, you have to get good footwear, extra wide, extra, whatever it is that needs to be done for your foot. So you have to get practitioners that you trust involved with your care, and you need to be paying attention. Like the minute that you have a change, you have to get on top of it.
So let's talk a little bit about skincare. I'm constantly asked questions as to what products are safe to use on the residual limb. So for example, what would be something that someone could use for their regular bathing and showering purposes? What kind of a product are they looking for?
Anything that is more natural is better. Lower pH, stay away from the mineral oils and the alcohols. All that stuff is really going to dry your skin more, and we need it to be soft and supple and moisturized.
Okay.
But not too much.
And then
don't go too
it's
far in the other direction. You got to find that nice happy medium. So you've got to work on finding a product that works for you, and everybody's really different. So it's super hard to say like this brand works for everybody. You are going to have to like experiment a little bit.
Just see what works. So also involved with caring for the skin on the residual limb, it's also managing the hygiene of the liner. So I know that when I have newer patients come in, I always encourage them to take one of two options. When they're cleaning their liners, I try to encourage them to use the same soap and body wash that they use on their skin in their body liners and to rinse it out with hot water. If, however, you find that you're having problems getting all that soapy residue out of the liner, then just to clean it with hot water. So the key factor here, folks, is rinsing, making sure there's not any soapy residue left behind that can cause some pretty nasty problems like dermatitis and other skin rashes. So speaking of which, what do you recommend when someone has some sort of skin abrasion, either from overuse of their prosthesis, their liner, like a blister, for example?
Yeah, blisters are going to be super common. They're really because of friction and shear, and anytime we have heat involved, that's going to play a factor as well. But if it's a serous filled blister, so it's a clear blistery fluid, that's usually pretty, benign, like it's just a blister. Try to leave that skin intact. Don't pop it if at all possible.
To pop or not to pop, that is the question.
Try to leave it because that's the biological dressing, the cover dressing that your body has made, and it'll protect you from infection. So just keep the skin there. You might use something like a drawing salve to kind of draw the moisture out, but it'll still keep that skin intact. If it is a blood-filled blister or it opens, then that might be a time where you're going to use another, like a transparent film or a Tegaderm or something like that. But ultimately, you are going to have to stop wearing your prosthetic until that blister is gone. You can't keep putting it on. You're either going to make the blister bigger, or you're going to force it to open, or you're going to cause another one. So even though it's a total bummer, you're gonna have to take a break.
And not only that, folks, but you need to figure out what is it that caused the blister. Was it overuse, over wearing the prosthesis? too much sweat in the liner, or is there something about the fit of the prosthesis that is causing the blister? And these are all questions that can be addressed with your prosthetist and your physical therapist. But most importantly, the priority is keeping that skin intact and healthy. So like Heather said, if a blister or any kind of skin abrasion occurs, keep the leg off until you've been able to address and heal that part of the skin. So one of the most common issues, as you've experienced this weekend here in Florida, is hot, sweaty, humidity, okay? And one of the common things that I see in my clinic are heat rashes and also fungal infection type yeast rashes. So can you tell us a little bit about both and how to differentiate and things that people need to know about it?
So a heat rash is going to be more of like the red little dots, more like little pustules maybe, a little bit more pinpricky looking. That is, strictly heat. That should, if you're able to get out of the heat, get in that air conditioning, let the skin breathe, that's really going to help. And also with heat rashes, a lot of times people become more susceptible to it when they're shaving. So as the skin grows out, it's kind of causing ingrown hairs and things like that. So you want to not shave that leg. You might trim it, but don't shave it completely. So leave a little bit of hair out. And the best thing that you can do is get ahead of it. So with the weather changes, it's happening, is really use the products that work. And again, it's like a little bit of, you got to play around with some things, and you might have to change your products depending on the season, the weather, the temperature, and stuff like that.
Okay. And as far as like the yeast infections are concerned, what is the difference between that and a heat rash? What would you see?
It's going to be a little bit redder, drier, flakier, like a scaly look to it. And sometimes the heat rash and the fungal, like if you let it go too long, things can actually combine, and it's like kind of a mishmash of everything happening at once. So if you think it's a fungal, or the stuff that you're using for the heat rash isn't working, then I would try adding in an antifungal soap or lotion, probably at night when you're going to be leaving the leg off, and you can just kind of let it soak in. And then if you're not getting better, or it's spreading or getting worse, because yeast can spread, you don't give it more than a week before you get to the doctor if it's spreading, because you might need a pharmaceutical.
Yeah. Basically, if you don't know what it is, get thee to a doctor.
Yeah.
All right, Heather, this has been so informational. Thank you so much for your time. Where can people find you if they have any questions about wound care or skin management?
Yeah, feel free to reach out to me. I'm on Facebook, so Better Wounds on Facebook, and also on Instagram. I do Facebook Lives, just taking questions, so you can feel free to jump in, send me a picture. I might use it for a live topic. If you send me a picture, I'm going to ask for permission to use it. But it's just to help somebody else. So Better Wounds.
Thank you, Heather. And folks, she really is sincere about that. If you have any questions, find her on Facebook. Everybody needs a go-to person. She's definitely my go-to person for wound care and skin management for my patients. So guys, thank you for joining us right now. Make sure you check your email boxes for your personal roadmap on skin care and wound management. If you haven't signed up already, you can do so by going to www.restoreyoureveryday.com. Thanks for joining us, guys, and I will see you on the next show as we restore your everyday.